How do I know the COVID-19 vaccine won't cause long-term side effects?
If you're concerned that the COVID-19 vaccine might cause long-term side effects a long time after it's given that we don't know about yet, I can tell you that that never happens. There's never been a vaccine that's caused serious side effects a long time after it was given. When vaccines do cause serious side effects, they always happen within a few weeks after the vaccine was administered. Now that hundreds of millions of people have been vaccinated against COVID at least 6 months ago, and in many cases as long ago as a year, we know what serious side effects might occur with these vaccines. And fortunately, we know that they're extremely rare.
This study from the New England Journal of Medicine looked at the chance of experiencing life-threatening problems after receiving a COVID-19 vaccine or after being infected with COVID-19. As you can see, the risk of each of these serious problems is very low in people who get the COVID-19 vaccine. For some problems, the risk in people who have been vaccinated is even lower than in people who haven't been vaccinated. That's what the negative numbers mean. By comparison, when you look at these problems among people who had COVID infection, you can see that the risk of serious problems like bleeding into your brain, myocarditis, heart attack, blood clots, kidney damage, and heart arrhythmia are much higher with COVID infection than with vaccination. And of course, there are other risks of COVID infection, like getting pneumonia, ending up on a ventilator, and even dying.
What about long COVID? Is that something I should be worried about?
We don't talk about long COVID enough. And part of that's because we don't really understand why it happens, how to treat it, how long it lasts, etc. But I am seeing it more and more in my clinics. The patients that I have been treating have come to me because I'm a pulmonologist with persistent shortness of breath, with just everyday activities. It's simply getting the mail, something that they've taken for granted and done their entire life, takes every bit of strength and energy from them. There's some people who have chronic dizziness and difficulty with their heart rate. Anytime they exert themselves, their heart rate goes up.
When patients who have had COVID still have symptoms 3 months or more after they were infected, it's called long COVID. Studies show that more than 1 in 3 patients will have long COVID. Long COVID symptoms include trouble thinking, headache, anxiety, and depression, trouble breathing, chest pain, rapid heart rate, fatigue, muscle aches, and pain.
Are there any treatments for long COVID?
I wish I knew what the treatment was for long COVID. At this point, it's primarily supportive, and this is what my patients are trying to do. They're working with physical therapy, some of them on a daily basis, trying to increase their stamina over time, but it's been months of symptoms and not a lot of progress for some of my patients.
The studies are clear. Your risk of having long-term problems is much higher with COVID infection than with a vaccine.
For more information, visit www.covid19letstalk.org.